Okay. Hi everybody. My name's Andrea. I am a DFA member, and I work with the Health Equity Justice sub equity group, and I help with the reproductive portion. Today, before we get started, I want to take a quick minute to invite you to officially join Doctors for America. Being a DFA member today means taking the important and simple step of selecting a membership level and paying your annual membership dues to support DFA's organizational sustainability and incredible programs like this Advocacy Grand Round series. There are 4 different levels to choose from. A DFA team member will put the link to join in the chat. And there it is. We will be making a recording, and all materials will be available afterwards. A few quick ground rules for this educational session is there's no such thing as a stupid question. Speaking of questions, please remember to use the Q&A feature. We will address your questions during the second half of our session, and also look out for comments in the chat. DFA staff will be sharing helpful links during the session. And now on to our speakers. So I have personally worked with Gretchen and Liz in the Connecticut legislative session, and they are amazing powerhouses who I've learned so much from. And so I'm excited they are here today to share their wealth of knowledge with you guys as well. So really briefly, Liz is a proud abortion storyteller, a co-founding board member of the Reach Fund of Connecticut, and a former clinic escort volunteer. She is now the state director of Reproductive Equity Now in Connecticut, and she is amazing and fantastic. So then Gretchen Rafa is the Director of Public Policy, Advocacy, and Strategic Engagement at Planned Parenthood of Southern New England, which serves over 60,000 patients yearly for reproductive and sexual health services. Liz and Gretchen together, along with other elected champions and coalition partners, lead bold policy efforts and have secured legislative victories, including data privacy protections for those seeking and providing abortion care, and the first shield law in the country. They also host a bunch of educational sessions, holding an annual lobby day with OBGYN physicians and medical students at the State House, and continuously are working on helping improve access to reproductive healthcare in the state of Connecticut. And with that said, I'll go ahead and let them introduce themselves just a little bit more.
Hi, everyone. I'm Liz Gustafson. My pronouns are she, hers, and I am the Connecticut State Director with Reproductive Equity Now. Thank you so much for joining tonight. A little bit more about Reproductive Equity Now. We are a state and regional organization working to make access to the full spectrum of reproductive health care a reality for all people. So thank you so much, and I'll pass it over to Gretchen.
Good evening, everyone. Gretchen Rafa, she, they, from Planned Parenthood of Southern New England and Planned Parenthood Votes Connecticut and Votes Rhode Island. I am the Chief Public Policy and Advocacy Officer, and I said all of those titles because I wanted to make it clear that I represent Planned Parenthood of Southern New England, which is a healthcare and organization that sees patients across Connecticut and Rhode Island for sexual and reproductive health care. We see over 60,000 patients across 2 states. We are an educator in communities across the state. And on the advocacy and political arm, I do my work under Planned Parenthood Votes Connecticut and Planned Parenthood Votes Rhode Island, advocating to protect and expand sexual and reproductive health care policy. I have been doing this work for 25 years of my life. And I usually always start when I'm talking about how I became an advocate with where I started my career in the health centers at Planned Parenthood in San Diego, because it is my experience supporting patients that come to Planned Parenthood, and really having that experience one-on-one with patients coming for care, and really helping to make clear to me what health inequity looks like in action when people face barriers to accessing the healthcare they need. As someone that grew up with the privilege of being able to access healthcare and the healthcare system freely. And I also name publicly that I am also a proud Planned Parenthood patient, and this advocacy work is very personal to me as a queer identified person that has relied on Planned Parenthood for over 3 decades of my life for compassionate, life affirming, and inclusive healthcare.
Great. And today, your moderator is going to be Anusha Singh, and I'll go ahead and let her introduce herself.
Hi, everyone. I'm so excited to be part of this awesome conversation with these two powerhouses. Well, technically 3, including Andrea. And my name is Anusha. I'm a 3rd-year medical student at The Ohio State University College of Medicine. I am really passionate about menstrual equity advocacy under the sphere of reproductive justice. And in Ohio, I started a student group called Period OSU 6 years ago. And together we advocated for repealing the taxes on menstrual products, as well as advocating for the allocation of $5 million for free period products in all public schools, which became the largest funded period program in the country. So I'm really passionate about that work, and I've led a bunch of campaigns about it. But yeah, I'm really excited to be part of this important conversation. And I can kick it off. Since I'll be asking the questions, and feel free to chime in, everybody. So my first question for panelists is that, given that we are all in different legs of our legislative advocacy relay, would you be able to provide a brief overview of the legislative process, highlighting the points in which we as healthcare professionals can have the most significant impact?
So I think that question is really important because I think depending on what state you're into, this will look a little bit differently. As I said up front, I do advocacy and policy work in Connecticut and Rhode Island, and those 2 state legislatures, let me try speaking clearly. 2 state legislatures are very different in how they operate. But I think what is really important for that we can highlight is how important it is to be involved throughout the process. So it might be that, and this is going to look again a little bit differently depending on what state you are, but the legislative game in every state should work somewhat the same. In every state legislature, it is made up just like Congress, with a House and a Senate, a governor, and bills are introduced. Bills are assigned to committees. There's public hearings that allow public input. Committees usually vote on bills, on whether they're going to support the bill and it gets to advance in the legislative process, or they're going to kill a bill. Then it goes to a full House and Senate debate. Sometimes they have to go through both chambers at the same time. Again, kind of depends on where you live and what state legislature you are. But there is usually a process for how a bill becomes a law that's pretty similar in every state. And every state you will have access to a state General Assembly website, where it usually offers a lot of information for folks that don't understand the process or don't know about the process in their state, who their legislators are, that they can find that out. And what I think is really important to think about as healthcare professionals is how important your voices are throughout that process. Because sometimes it is a healthcare professional that could be having a conversation with elected officials. And again, I said state, but it could be, your city or town elected official. It could be members of Congress, about a problem that you see in whether it's a hospital setting, wherever, like your experience and problems you've identified. If you are able to bring that to your elected official early on, you might be talking to them about introducing a piece of legislation, or a piece of legislation might already be introduced. And healthcare professional voices are so important in the lobbying efforts by sharing, public testimony and sharing stories about your experience caring for patients, caring for communities, and elevating and identifying and humanizing the problem for legislators and elected officials. That can have the most powerful impact, because your voices in that process, whether it is from point one, where there's just a problem you're bringing forward, to drafting a bill with legislators, to, again, sharing your story in a public hearing, to making calls as a group of healthcare professionals, making calls to committee chairs or legislators to urge them to support or defeat a bill. I don't want to say that there's the most important point in a legislative process, because I think that healthcare professionals' voices are so important to be involved throughout the process. So I don't think there's one particular point where I say will have the most significant impact, but I think some of the most powerful parts of the legislative process, wherever you're doing it, is through sharing your expertise, your personal and professional experiences, and patient experiences, and kind of an understanding of the complexity of the healthcare system. You all might think it's pretty easy, but for legislators, you might be the first person explaining how your hospital administration has determined they're going to do something through the billing process or something like that. So you have an opportunity to educate legislators on something they normally don't know, specifically about a healthcare procedure or a healthcare issue that they're just not in the know about. So I don't want to say there's one particular, like, the most important. And I know I'm a little bit rambly on this point, because I do think that throughout the process, healthcare professionals' voices are so critical in advocacy and advancing the, public health priorities of our communities. And I will just say too, depending on what state you're advocating in, there are some states that there's part-time legislatures and there's full-time legislatures. So there's a window of period depending on the state. In Connecticut, it's a part-time legislature. In Rhode Island, same thing. You have between January and June, February and May on certain years, to be effective in the legislative process.
I'll just add to that too, to agree with everything that Gretchen just said, but also after a law is passed, signed into law, and in effect, the implementation of said law, we need to hear from providers directly if the implementation is actually happening and or if there are barriers out in the field. And as Reproductive Equity Now, that is critical information for us to know as advocates and as myself, as a lobbyist, to know so that legislators can know that information, to know if there's any fixes or what have you, or if there's anything we can do outside of the traditional legislative process to fix that. Because the second half of all of that is implementation, because a law might be passed and in effect, but is it actually making a difference on the ground in every single community where there's access barriers, what have you? And so just to add to that, and then I will also say too, as an abortion storyteller myself, it is always really affirming and meaningful hearing providers advocating on behalf of their patients. I still get emotional to this day anytime my specific abortion provider, who is a Planned Parenthood provider, testifies, but anytime any provider boldly advocates on behalf of access to abortion, but also the full spectrum of sexual and reproductive health care. It means a whole lot. Abortion storytelling is community care, and y'all have a real opportunity to continue doing that as providers too on behalf of your patients. So.
Can I say one other thing on top of what Liz said? If not, say no. Okay. Because she brought up something so important in the implementation process, and where I have seen healthcare providers be their voice is so crucial is in the regulatory environment. So I was just saying about passing bills, but another big piece of policymaking is through the regulatory process. And some of that comes with the implementation once something passes statutorily. And I will speak again on behalf of advocacy work in Connecticut, Rhode Island, providers coming in and using their voice, their expertise, and being a critical voice in kind of the advocacy around regulations, and weighing in on regulations is super important. Sorry, that's my really professional way of saying like your voices are critical.
And so, just kind of going off of that, as a provider who is in the advocacy space, who is into legislative advocacy, um, learning how to navigate or how to get a step into the field is kind of hard. So what recommendation would you make in terms of like how do you get into these like regulatory roles? How do you go about meeting legislative advocates or like even like getting into like organizations who might be already doing some like work in the field and getting your feet in, your toes in?
Doing what you're doing tonight is a really great way to start. There's organizations, advocates, and folks in every single state and nationally as well, for folks to plug into. And their tactics definitely vary because depending on all sorts of things. But there are folks who are finding ways to either advocate and make change or ensure that people can get the care that they want and need in a very fractured landscape of access, but your voices and commitment to providing quality care and compassionate care and showing up for patients, I think the willingness and desire to do that is the first thing. And plugging into organizations. And if you are not in Connecticut, Rhode Island, and Massachusetts or New Hampshire, because Reproductive Equity Now also has operations in those two states. Gretchen and myself, not to volunteer Gretchen, but at the very least, if you are seeking organizations working on the ground in your respective state, if you're not from one of those, we are happy to always be a resource to and connect you with folks, because the repro movement is vast and large, but also very interconnected, especially now. So I will say that.
Yeah, I appreciate you both, all of you shedding light on the legislative advocacy, like the whole process and like all the different points in time where people's voices, particularly providers, medical students, people in medical profession, where their voices really do matter. And it seems like there are so many different points of time from the point legislation is introduced to, I mean, before it is even introduced to after it is. So I think that's really insightful to take away from. And that really leads pretty well into my next question. What do you think and what do you believe specifically is the most urgent role medical students and future physicians can play in protecting and expanding reproductive health access, whether that's locally or nationally?
I'm so curious how Liz is going to answer this question. Because I think one of the things that, because I've been doing this work for quite some time in the advocacy role, I've seen kind of the impact on different pieces of both state and federal legislation where bringing in healthcare professionals and provider voices has been kind of the point where, something has clicked in terms of like legislative supporting or patient stories. And again, I've only worked for Planned Parenthood and advocated on behalf of Planned Parenthood patients. So patient advocates have also been really important. And so I know there's a fine line where like providers can't cross in the exam rooms of like lobbying for something. But I think sometimes for folks that, are from communities most impacted by systemic oppression and health inequity. Some of the first line of contact are community healthcare providers, or for example, Planned Parenthood is oftentimes the first entry point into the healthcare system for women specifically. That you might be those folks that could be saying one thing in an educational setting with a patient that also might spark something that people like patients didn't know either. And then that might inspire a patient to also feel more, to have the like information they need to feel empowered to advocate on behalf of themselves. But that's why I think the provider storytelling, and I'm saying provider storytelling, whether it's in the halls of Congress or in their local coffee shop with a state elected official or a decision maker, you might be that connection for that story to be shared with someone that has the power, an elected official, to actually vote the right way, make change that could impact not only patients directly, but the larger healthcare system. And, sometimes I will use an example kind of to help drive this point home. But last year in the state of Rhode Island, we made a strategic decision to have healthcare providers be the lead voices and the lead basically voice for the coalition to advance a healthcare provider shield law. Advocacy orgs like Planned Parenthood, Votes Rhode Island, and LGBTQ plus advocacy orgs and other repro rights orgs were all there lobbying and being very vocal in support of direct lobbying. But we had the providers be the frontline voices in talking about this being so critical to providers feeling safe and protected in a state that says, this healthcare is legal, because this would protect providers and patients for reproductive and gender affirming healthcare. But having a cohesive and aligned group of medical professionals that was led by kind of convened by the Rhode Island Medical Society. But these providers were really front and center. They were the voices that, we always highlighted publicly and made the story about protecting healthcare providers and making Rhode Island be a state that's going to, stand by their providers, have their providers back, and make sure that it is a state where providers also want to stay and practice medicine. So if they're med students, keeping med students that are graduating and staying and wanting to stay in the state of Rhode Island, because Rhode Island was going to have their back. And I'm bringing up that example because it was probably, a very significant policy win for us, where it was like, the advocates can do the direct lobbying. I'm at the state house doing the direct lobbying, but we need to really elevate the providers' voices in this. And it was so effective that in very unexpected advocacy world, we passed the bill in one session, which is usually really unheard of in any state legislative fight. But it was because the healthcare professionals and the providers were such effective advocates for this piece of legislation.
I would add to echo Gretchen's point, as reproductive equity now, and as myself, as someone who's been in this work in various iterations, from clinic escort volunteering to advocacy to lobbying to abortion funding. One thing I know is that providers have always been resilient, whether it be a global pandemic, hostile Supreme Court, a hostile government, a hostile state legislature. Regardless of all of these circumstances, providers continue to find ways to show up for their patients. And people have always needed abortion care, regardless of zip code and who they are. And so, again, as a patient and all of the other titles and things, I urge and ask and suggest finding a way, taking your own risk analysis, of course, as to what you may be able to do in your own circumstance, but finding a way you may be able to help folks seeking that care and the care that they need. Whether that's volunteering, whether that's in your professional capacity as providers, whether that's advocating and influencing and testifying on behalf of critical legislation at the state, federal, local, what have you levels. I would urge that. and continue doing that. And also continuing to be, to Gretchen's point, boldly pro-abortion, because abortion is healthcare and is a human right. And the more providers that are talking about it openly as such, really does have a significant impact. So
You just made me think of another thing too, Liz. Not only just like being bold and unapologetic about, the healthcare that you deliver, and really, I think what healthcare providers bring in kind of a unique way is talking about healthcare that's been politicized, whether it's abortion, whether it's gender affirming healthcare, in a more, again, human way. This is just the medical standard of care. This is how I need to treat my patients. Like healthcare providers delivering that, Liz and I are really effective advocates. So I'm not going to say we're not effective advocates. And there is something different when a provider is like explaining that and breaking it down in a way of like, no, what you're hearing is wrong. That's actually not how medicine works. And doing it in the most, respectful way as you can, because again, electeds don't know this unless they're providers, but you're able to like dispel myths to oh my gosh, words are not coming to me tonight, but piece apart, defistimize. Thank you for trying to read my mind, but demystify, again, every time an abortion provider says, abortion isn't one of the most safe medical procedures. Oftentimes people that hear all the myths, they're like, no, really? I thought this and this. And then they're like, nope, this is the complication rate. Yep, that low. And it's coming from providers is so much different than coming from advocates or people that aren't able, like the actual medical experts and delivering that healthcare. So I think by talking about abortion care, by talking about gender affirming healthcare, and really kind of simplifying it for people and talking about it as just the medical standard of care. No, this is how healthcare is provided.
I love that so much because in a way, I feel like the way you explain that, it makes it seem a lot less intimidating for medical providers who are interested in talking to lawmakers, also medical students who want to make their voices heard but are afraid, oh, I don't have enough lobbying experience or legislative experience. But really, I think the core of like both of you, what you mentioned is your stories do matter and they do have the ability to make an impact. And really to not underestimate the power of your voices, whether it's stories that you've experienced, that you've heard from patients, or your medical knowledge. And I think thinking of it through that lens can really empower a lot more people who are interested in making their voices heard in the process. So thank you for sort of dispelling those myths about the process. My next question is, I know y'all have been, you've organized lobby days for in your state at the State House, where you partnered with residency programs like the OBGYN residency program, medical providers, and really allowing people to make their voices heard. And I was curious to learn more about what advocacy tools or tactics have been most effective in your experience in mobilizing medical professionals.
I think it varies depending on the time of year, the point in session. I will say lobby days can be effective and have been effective. Also, we will typically do, and we've done it together, both Gretchen and I, where we will do legislative advocacy workshops before public hearing to the best of our ability, because we can't always foresee when public hearings are going to be scheduled. But we'll do workshops with med students, with different medical associations, whoever wants to come, the more the merrier. And we'll give an overview of what it's actually like to testify at a public hearing. Connecticut has a hybrid legislative session, so folks can testify in person and or via Zoom. And so we kind of walk folks through the process to kind of demystify the legislative process, because I think they make it spooky and intimidating on purpose, which is just like my professional opinion. And it still spooks me out, even though I've testified a million times. I panic every time. But we just kind of get folks familiar with how it might go so they can really focus on the content. We also will send out action alerts, both of our organizations. We'll send out action alerts when public hearings are happening. So folks, if they can't testify virtually or in person, submitting written testimony is still incredibly effective. It's on the public record. Legislators absolutely will refer to it, or we will highly suggest that they do. And that comes in handy when if bills are being like brought on the floor and a debate is taking place. Sometimes that is the very thing that they are looking at. And having it on the public record is really, really important to inform the current legislative process and future. If things don't pass, that doesn't mean we don't stop trying. And so then we will be reaching out again to see if you will testify again in the future. There's a lot of advocacy tools too, like at Lobby Days. It's also us in Connecticut. To kind of give a visual, there's ropes that we will stand behind and try to catch legislators when they're going in and out of the chamber. We'll also help and assist folks setting up individual meetings or a meeting with a couple legislators if possible, or they're specific as a constituent in the state with their state rep and their senator. That is effective too. And also just like, again, if you are living and practicing, I say the same to college students, like you are a constituent, so you have a right to have an input and a say in how they are doing business under the dome in the people's house, i.e. the Capitol. And so also just reaching out to your state rep and reaching out to your state senator and having a conversation or asking them why they voted a certain way or where they stand on certain things that are important to you, or just also letting them know what's actually going on the ground. Gretchen made a really great point earlier on you might be the first and like a critical touch point for a legislator to like actually understand what the standard of care is and what it's actually like being a provider or a med student. And so that is incredibly effective. And then also reaching out to organizations like ours if you are noticing barriers to implementation or you have concerns, and reaching out to your elected officials too. I think that is incredibly effective because nothing changes if nothing changes, and if we're also not being informed, or your elected officials are not being informed that you are experiencing something or there's an issue, then again, that is incredibly effective. And that is how we have passed laws before, is hearing directly from providers that this is a problem that my patients are experiencing and we need to fix it. And so I'll stop there. I know I'm rambling a little bit.
I'm just going to add one other tactic, unless I missed this in what Liz was saying. Sign-on letters. Did you say that, Liz? And I missed it. Like provider sign. Liz was talking about lobby days and like getting providers all up there, on one day. White coats are very effective. It's about power. So we're trying to shift the balance of power in the buildings that we're legislating. I know certain providers have a different relationship with white coats. And we oftentimes use that as a tactic, because if you have 25 white coats lined up trying to talk to senators or representatives, they're going to come over and talk to the white coats. Like, we have to use our power strategically when we are doing our advocacy, and recognizing that y'all are really busy. Providers don't have like spare time because you're seeing patients and stuff like that. Oftentimes the legislative process is really challenging for public engagement, especially if you have part-time legislatures. So one of the tactics we have used and coalition partners have used is getting provider sign-on letters. So what that might look like is if we are part of a coalition, for example, trying to pass healthcare coverage for undocumented folks. A lot of the work that has happened year after year is engaging the provider community, but we can't get providers up there all the time to the state capitals. So we have an ask out to a provider network. Will you sign on and support? Having 100 or like, you don't even need 100, but like I'm saying, we've gotten like over 100 providers to sign on to a letter that lays out the problem, lays out the human impact of lack of access to healthcare, demanding that the electeds do something. So those provider sign-on letters are sometimes, I'm going to say, an easy way. You can be really effective in advocacy while you are still seeing patients or doing whatever else you're doing as a healthcare professional when you can't like make it out to a lobby day or up to your state capitol. So I just wanted to jump in there.
And I'll just add in that the person that Gretchen was referring to about different feelings with white coat is me, because I hate my white coat. I can definitely attest.
You're not the only one.
Happy. I can definitely attest to the fact that having that white coat definitely gets their attention and definitely makes them more amenable to talking to you and not being as ignored as often. So absolutely.
Yeah, and I like how you laid out like the different forms of and lanes of advocacy almost. So based on people's capacity, I think there's like this misconception. In order to be an activist, I have to like go to Capitol Hill and rally in front of lawmakers every day. But it could be as simple as a sign-on letter, which still has an impact. Having uncomfortable conversations, educating the people around you about abortion, and testifying also. So many like different ways that people can make their voices heard based on their comfort levels, their capacity, all of that. So thanks so much for touching on that. And I think that really segues pretty well into my next question. How can we get involved in reproductive health equity work without burnout or and performative activism?
I'm going to answer the second half of that question. As providers, as med students, it's not performative activism. You're doing the thing that people need. And so I just want to give you that affirmation. And also seeking out organizations or opportunities to get involved and plug into. It is not performative, but if you are the ones performing care, you are doing the thing, and thank you for continuing to do that or seeking to do that. In terms of burnout, I'm going to say, please take care of yourselves. I think it's also to the best of your ability. But I know I mentioned it earlier, doing your own risk assessment. That can be legal or physical risk, but also personal health, mental health, and personal capacity risk. If you are showing up for patients, you are already doing a lot. And I will say, of course, I know for the past 43 minutes, we've been talking about how critical it is to hear from providers. But if you need a minute or more than 1 minute to take care of yourself too, I encourage you to do so to the best of your ability. But I will end there.
I think it also depends on where you are in your journey and, your professional journey. If you're to kind of manage that, I can only imagine what it's like to be on the front lines of direct patient care. working within a system that is a broken healthcare system in our country and having to make the most challenging decisions for your patients sometimes. If you're fighting with insurance companies or insurers to cover a procedure that your patient needs. I mean, I don't want to minimize that kind of advocacy either. If you have to get on the phone or write a letter to get coverage for a patient to get the procedure or the medicine that they need, that's advocacy because your patient or a patient might not know how to do that on their own. So I think there's other things to think about when you're thinking about healthcare professionals' role in advocacy, that it might look very different. Liz and I have taken a path, and I'm sure many people that might be listening to this are taking different paths in, the healthcare field, but we've taken a path of like making an impact more on a macro level. We're both trained macro social workers, and we have decided to do this as our, journey. Advocacy is what we live, eat, and breathe every day. And that might not be the case for medical professionals. So I think in thinking about burnout and balancing it with your already professional, like the burnout that healthcare professionals in this country are facing overall. I mean, I don't even want to just say because of COVID, like before COVID, but like there's just real burnout for healthcare professionals that I think it's picking what tactic might make sense to you. So like I said, we listed off a lot of things that you could be involved in, but it might look like one time, a Liz or Gretchen in your state might say, hey, we could really use again, we're going to say an OBGYN because we're doing repro work, but like to speak at a press conference. That is a tactic that we use to, change or shift the public narrative or, again, make sure the public narrative is with us on the issue. And that might be your advocacy for, the year. And it's, again, not performative activism. If you just do one thing that feels like advocacy, because I would say, and again, maybe this is because I've just been doing this for quite some time, every day in your roles, whether you're, frontline healthcare provider in the administration in healthcare settings, you're doing advocacy, probably when you don't even know it.
Yeah, I appreciate you like dispelling those myths and misconceptions about performative activism and like what advocacy is, right? Like, in a way, I think we can all call ourselves advocates. I think people feel like, oh, you need to do all these fancy things in order to call yourself an activist, but really, like having those conversations over the phone, which a lot of providers do, um, already makes themselves an activist, and it's about really being brave enough to pick up that phone and take the next step and take it to the state house, and there's so many different lanes of advocacy, like you mentioned, that can make an impact. Andrea, I know you're in a resident of no, you're in your fellowship now. Sorry. I thought it would be really interesting to hear about what you think about burnout, especially as a medical provider.
So I agree with everything that Liz and Gretchen have said. The only thing that I will add is that I think it's definitely important to like find your people and find people that are also fighting the same fight as you, because at least during like this legislative session, the amount of times I would text Liz and Gretchen like ranting about whatever, fake news somebody's saying about the bill that we're trying to pass, like it's cathartic, right? And so avoiding that burnout is also finding the people that you can, fight with and like also like relax with and kind of try to find the joy of the fight with. Um, because it's an uphill battle and it's going to be it's a long journey. And so finding people that you can go along with, I think is really important. And the other thing that I also use a lot is trying to like the healthcare system it's hard, and it is a fight daily, from like having to get prior auths for like contraception or like IUDs or like a surgery. It can be morally crushing, but trying to like remembering that what we're doing is for the patient and like really centering it on the patient, I find to be helpful.
Yeah, thank you so much for sharing that. I think it's really helpful to hear your perspective as well, as a healthcare provider. And that leads me into my final question. Before we open it up to questions for everyone, Um, what have been some of your legislative wins or your most memorable legislative events or moments, and what do you think contributed to their success?
Well, as I shared, I've been doing this for a couple of decades now, so I feel like I am privileged to also be doing this work in two states that have worked really hard to protect and expand sexual and reproductive health care. And I will highlight a couple of wins that I think tell an important story of the generation of activism. I've had the privilege of working in reproductive health advocacy in Connecticut, like I said, for almost 2 decades, where this state had codified the protections of Roe in 1990 before I was an advocate. And, for years and years, I mean, which was fantastic, obviously, back in in 1990, but for years and years, um, you know, really for decades, we hadn't touched that statute and it was outdated. It wasn't aligned with the medical standard of care. It had restrictive physician only provisions in the regulations. What we knew to be true was in the state of Connecticut, patients were waiting longer and longer to get an appointment with their abortion providers because only physicians could provide abortion care. There weren't as many physicians. Again, these regulations were outdated. And we took a stance as advocates and said it is time to modernize our state law and expand the pool of healthcare providers that can perform aspiration abortion care in the state of Connecticut, which meant patients would have more access to their trusted healthcare providers. And update the regulations that were medically inaccurate, outdated. I say that as a huge legislative win because one of the things that, advocates had been concerned about is if you touch that statute, that's going to open up the floodgates for parental notification laws and policies, because thankfully we're also a state that we do not have parental notification or consent laws on the books. So there was some hesitation, or not hesitation, but there was some worry, I think, for decades to really touch that statute. And we recognized the urgency of the moment. And while we were doing that, we were also working with legislative champions and coalition partners to pass the first provider shield law in the nation prior to the Dobbs decision. And so while we were expanding access to abortion care through modernizing our outdated statute and regulations, we were also putting into place protections for providers and patients that would eventually need to cross state lines to access this care. And I say, it's one of the most memorable because for me, as someone that's been doing this work, the people that came before me were the people that fought to codify Roe. And I was able to be a part of the next generation of protecting and expanding abortion care and access in our state. And so for me, again, having healthcare providers be a part of that advocacy, doctors were essential in helping us modernize the law. What it meant was more providers outside of doctors were going to be able to perform abortion care, but it was OBGYNs that were actively talking about it and advocating and talking about why these regulations are outdated, medically unnecessary. There's no reasons that these should be on the books. That was such a key point of the healthcare provider network coming together, from docs to advanced practice clinicians, all coming together to say, no, we need to make sure that what the legal right to abortion is accessible to everyone that needs it. We need more providers in our state. And again, this was a generational win that to just continue to advance policy and find ways to modernize policy. Even once you pass laws, they're going to be outdated, especially when you're passing laws about medical procedures, which is even kind of gross that we have to be talking about that. But the fact is they're going to be outdated. They're going to be needed to be flexible and updated. And for me, 3 decades after Roe was codified into state law, for us to be able to make such a significant impact in statutory and regulatory changes in the state was really meaningful. And we had such a broad coalition, and providers were such an essential part of that. And I will also name a huge win for us in Rhode Island. Codifying the right to abortion in 2019 was a decades-long making. And it was a lot to get to that point. And then, what was really important advocacy after that was making sure that we didn't stop there in the state of Rhode Island. And for several years later, fought to expand access and reduce barriers to care by passing the Equality and Abortion Coverage Act, which ensured Medicaid coverage for abortion. And that feels really significant in this current political atmosphere that we are in, because as someone that was born post-Roe, I never really actually thought we'd get to a place where we are today, where it is a state's decision. And, there are, just a handful of states, left that are providing safe, accessible, legal abortion. And so advancing and expanding access has been such an important part of my advocacy and policy wins. And I'm lifting those two up because in the current climate, I already talked about the Healthcare Provider Shield Act. I think in the current climate, these are such important pieces of policy in the work that Liz and I do in sexual and reproductive healthcare advocacy.
Those are definitely highlights, Gretchen, and two that are definitely on my list. I will say, in addition to those, two really good examples of how policy may be influenced. One example of that is post the overturning of Roe and the Dobbs decision. College students here in Connecticut started to reach out to their elected officials, asking them, what are you going to do? And what about us? And we need better access as students of higher education here in the state of Connecticut. So then legislators reach out to Gretchen and I and other folks, and we came together to pass a law that requires Connecticut public colleges and universities to create and implement and continue to update plans to increase access to comprehensive sexual and reproductive health care for students at public colleges and universities. And so that is an ongoing effort. There is kind of a cohort of students and colleges and university folks and legislators and advocacy folks and providers who continue to meet to ensure that we continue to address any barriers that students are facing. But it really came to be because of the students reaching out to their elected officials. Another example of this was this past legislative session. We were hearing from providers that young people and minors were being denied or delayed the ability to consent to routine prenatal care or birthing related care, and also in some instances contraceptive access. And so we clarified statutory language regarding minors' ability to consent to pregnancy-related care and contraception, so that the law is not being interpreted differently across institutions or individual providers or technicians, what have you, but it is explicitly clear now, and that is because of ongoing advocacy by providers in the state of Connecticut. So I think those are two really also great examples and proud moments because it came from direct experience and on the ground, and the advocacy and voices of people who are impacted or care for folks who are as well. So And another win that's not legislative related, but I will say because it is speaking to a room of docs, med students, what have you, but also the launch of Reproductive Equity Now's pro bono abortion legal hotline for providers, patients, and helpers that launched last year in Connecticut, but we have operations in Connecticut and Massachusetts. And that is a free legal resource for anyone who has questions regarding their rights to provide access or assist those seeking care in Connecticut and Massachusetts.
Wow. I am feeling so inspired right now, especially as a medical student in Ohio. I'm like, wow, there's just so much like the breadth of legislation within the reproductive justice space is there's so many different issues that you can advocate for under the umbrella. And I think some of the issues that you talked about, I know that I am eager to talk to my medical school classmates about these issues and try to get these issues in front of our lawmakers in Ohio. And although it's going to be definitely an uphill battle, but I think I know I'm definitely taking away a lot of inspiration from like hearing these stories about these wins, because I think too often we hear about, oh, like this piece of legislation to work out or this in this state, but it's also really refreshing to hear about some of these positive stories that, especially from direct impact, hearing voices of healthcare providers and yeah, wow, that is awesome. I did want to open it up to everyone for questions. Feel free to, I believe in the chat. I don't know how this.
We don't have any questions in the Q&A.
Oh, okay.
So, thank you guys so much for coming and, being here with us tonight. This is really fantastic, and thank you for sharing your wealth of knowledge. I also want to give you this chance to if you guys want to, I know, Liz, you shared some links on the chat. We can go ahead and share that with the people who registered for the session as well. And that way they can sign up or have access to the resources too. Gretchen, if there's anything that you want to share, more than happy to also share with the following as well. Oh, I think we might have gotten one. They're saying thank you. Thank you so much to all of you.
Thank you for having us and for joining
Mm-hmm.
and also providing care. Thank you.
Yeah. And then I will go ahead and let Anusha finish closing up the rest of the session tonight.
Yeah. And I believe we also have a toolkit for y'all. I don't know if we sent it in the chat yet, but it's a link to our toolkit that we made. It details the legislative process a little bit and how to, specifically the art of testimony. So we just shared it out in the chat. That's something that you can take with you. We have templates that you can use also, some testimony tips, and yeah, some talking points. We also have an example from Idaho regarding some recent legislation, a restrictive abortion law that was introduced, and a fact sheet that we created with very state-specific examples that you can look to for as an example. But I hope this is helpful for everyone. And I also want to echo Andrea. Thank you so much to our two amazing panelists for all the insights, wisdom, and inspiration. I know I'm feeling super energized after this conversation. Like, I want to take action. I want to share with everybody, like, oh my gosh, these are all the different ways we can make our voices heard. And yeah, I'm so excited. I feel very hopeful, I think, because right now it's easy to feel like a loss of hope, but hearing some of these inspirational stories and the tactics that have worked, I know that I'm definitely going to apply those tools to my advocacy.
All right, guys. Well, thank you so much for being here and everything that you guys do on behalf of the patients. We hope you all will become an official DFA member and take a look at the benefits of membership on our DFA website. The number one reason doctors, medical students, and healthcare advocates join DFA is to be with like-minded people that share same values and priorities. So like we said, that's something to help with burnout, particularly in this current political climate. And remember to follow us on Twitter, LinkedIn, and Facebook to stay up to date with all of our events and ways to get engaged. Thank you for attending and have a great rest of your day.